Today we're going to be talking about assisting in a medical emergency in the dental office. So first of all, we'd love to prevent medical emergencies before they even happen. So how exactly would we prevent a medical emergency from happening in the dental office? One of the best ways is to just simply know your patient. So establish open communication with your patient about their health and make sure that you are maintaining and updating constantly their medical history. Every time they come in, the assistants or dentist or hygienist, whoever's seeing them clinically, should be updating their medical history. About every 2 years, the front desk should be giving them a piece of paper to fill out as their updated medical history form, which just is going to help you see if there are any changes that you may have missed. Knowing your patient is going to help prevent emergencies better. Most medical emergencies that do occur in the dental office are initiated by stress, whether it be something they're going through in their life or just stress from being at the dentist. No one really enjoys coming to the dentist. Maybe a few people do, but a good majority just have that nervousness, anxiousness. They hate coming to the dentist. That's going to cause stress on their body and therefore could allow a medical emergency to occur. Now, before a medical emergency even takes place, we should have some protocols and plans in place to help make a medical emergency go smoother. And one of these specific protocols that can be assigned is who is going to deal with assigned roles. Typically in the dental office, everyone is helping, so when a medical emergency happens, we need the help of everyone in the office. So front desk is usually going to be the one that calls 911, and they will remain on the line until help does arrive. They're closest to the phones, they have quick access to emergency phone numbers, they're going to call for help. The next, a hygienist or an assistant can go retrieve stuffs, whether it be oxygen or the emergency drug kit, an AED. They can run and grab stuff quick and bring it back to the patient. And then, of course, there needs to be a dentist that is helping the patient, but also an assistant or hygienist should also stay with the patient as well, just to help provide support to the dentist while they are helping the patient. Someone needs to be with the patient at all times. Very important. Don't ever leave the patient alone if they're having a medical emergency. Even to get help, try to stay in the room, either page someone for help or yell for help if absolutely necessary. And then any other team members that are available should respond to the needs of other patients in the office. There's most likely not going to be just the patient having a medical emergency in the office. There may be patients in the waiting room, patients in operatories, so any available staff that's not helping in the emergency situation should either be calming the other patients or maybe getting them out of the way, getting them out of the area so that the EMTs can come in and do their job as well. Routine drills are very important because sometimes when you're in a medical emergency, it's hard, your mind goes blank and you just don't know what to do. You're freaking out. It's hard to remember what protocols they may have discussed previously. So actually going through a drill and doing that role playing can help you remember better in an emergency situation. So make sure training is current. New staff should be trained, but also yearly training should take place as well, just to help keep that fresh in your mind. A mock emergency can be created monthly. That way the team knows their roles and knows what to do in case of an emergency. Everyone's on the same page. So it could be as simple as just asking where someone would go in case of a fire, or I don't know, even active shooter type situations seem to be becoming more frequent. So just practicing is going to make things a lot smoother. Each office should also have a designated meeting point outside of the office. So whether it's at your billboard sign out front, at a dumpster in the back, somewhere that is designated for everyone to meet there so everyone can be accounted for. So it is also helpful to have a list of any emergency phone numbers beside all phones in the office. That way if a medical emergency occurs in the back, they still have access to all of those same numbers as the front. So some of those numbers could be 911, obviously, is a main number, but also just your local non-emergency fire station and police station numbers. Maybe you just have a simple question to ask that doesn't require the call to 911, but you still need to contact the police. The non-emergency line is great. Poison control, in case a patient ingests something they should not ingest, Having poison controls number on hand is always beneficial. Near hospitals as well, in case some kind of issue is happening where you need them transported to the hospital. Recognizing a medical emergency. So we always want to take note of how a patient responds to their symptoms. Typically, patients are going to either tell us that something's not feeling right or show signs of it, whether it be they're holding their head or their heart, their chest, their stomach even. In some way, they'll show us that something's not right. It could be as simple as just saying, I feel dizzy, I'm having trouble breathing. Like, those are red flags that should go off in our head, something's not right. We should also take notes of signs that we observe ourselves, so changes in skin color or even an increase in respiratory rate. Emergency care standards. So basic life support is extremely important to know, especially in a medical office. So basic life support includes immediately recognizing that an emergency is happening, activating the emergency response system, so having someone call 911, accurately performing CPR, applying defibrillation when appropriate, and that would be done with an AED. So with an AED, they're very automated these days, so you just turn it on and it'll tell you exactly what to do. But typically, you'll attach the pads to the patient, exactly how it is shown on the pad. There's pictures of where to place it. Turn the power on, let the AED analyze the patient, and then the AED will automatically tell you if defibrillation is needed or if it's not. So it's doing that work for you. So in most offices, a standardized emergency kit is available and includes supplies such as EpiPens, aspirin, glycerin tablets, smelling salts in case a patient faints or passes out, all kinds of different medications to help in basic emergencies. These kits do need maintained though frequently, and maintenance will consist of routinely checking the supplies to make sure that they are still in working condition, making sure that there are no expired drugs or drugs even coming close to expiration. A lot of kits do have automatic mailing of close to expiration products. So when a product is maybe a month away from expiring, the manufacturer will send you a new product, and then you send them the almost expired product back to the manufacturer, and then they can dispose of it properly. So those are always beneficial. If though your manufacturer doesn't offer that, you'll just have to pay very close attention to those expiration dates to make sure that you are constantly updating them and keeping them current. Also, a daily check of oxygen tanks is beneficial. Sometimes there's small leaks and they could leak out all the oxygen, and then you're in an emergency and need oxygen, there is none. So definitely keep a constant check on how full those tanks are. Going more into oxygen, oxygen is the most frequently used drug in a medical emergency. It is ideal for resuscitating a patient who is unconscious but still breathing. So, not someone who requires CPR. We don't want to give them oxygen. In that case, we would do CPR and rescue breathing. But if they're unconscious but still breathing, oxygen is great to just make sure they continue breathing. A portable unit with tanks of oxygen should be stored where it can be moved quickly into a treatment room if needed. And then also the oxygen tanks are always color-coded green. If you see blue tanks in your office, it is nitrous oxide, not oxygen. So make sure you're grabbing the right tank, green. Emergency responses. So as a dental professional, we are responsible to recognize the signs and symptoms of a significant medical complaint and to be able to provide support to the dentist, whether it's helping the dentist during the emergency or even just simply calling 911. It is not our job to diagnose a specific condition. Even for a dentist, that may be hard. That may be something that a medical doctor at the hospital is going to be the one diagnosing, not the dentist. So most medical emergencies do occur right after or right before the administration of local anesthetic. People are scared of needles, and that anxiety can often put the body into shock, and then a medical emergency occurs. So be on the lookout for things that are happening during procedures when a patient is very anxious. If they come in anxious, you can tell they're very scared. Be sure to let the dentist know, let the assistant know, like, hey, this patient is very anxious today. You can often see if their skin is very pale or their heart is racing. Like, you're going to be able to tell that something's just not right with the patient. So you may want to bring that to their attention before they even see them. That way, if they're running behind, maybe we can get that patient back into a room a little sooner to get them calmed down and hopefully try to avoid a medical emergency from even happening. Next, we'll talk about common medical emergencies So first we'll talk about syncope, which is also known as fainting. That is the most common medical emergency in the dental office. It's caused by an imbalance in the distribution of blood to the brain and larger vessels of the body, which then causes that patient to lose consciousness. So a patient can faint for both psychological factors and physiologic factors. So some psychological factors would be stress from coming to the dentist, apprehension, fear, or even the sight of blood. And some physiologic factors could be remaining in one position too long, being in a confined environment, skipping a meal, or just plain being exhausted. Going more into syncope, signs and symptoms include feeling of warmth or feeling flushed, nausea, rapid heart rate, perspiration, pale skin color, and lower blood pressure. Some response steps to take if a patient does faint. First, we should place the patient in a subsupine position, which means their head is lower than their feet. So putting them in the dental operatory chair and then having them lay flat, raising their feet up higher than their head is going to be the best way to allow for blood to flow away from the stomach and back towards the brain. We should loosen any binding clothes on the patient. You can have an ammonia inhalant ready to administer by waving it under the patient's nose several times. These should be available in your emergency medical kit. Oxygen should be ready to administer in case the patient does not wake up in a timely manner. You should also monitor and record the patient's vital signs, and if the patient remains unresponsive, you can then call 911. So going more into talking about how a patient can be positioned poorly and that could cause them to faint, that is called postural hypotension. So it is a level of altered consciousness that may lead to a loss of consciousness. So it commonly occurs when the patient assumes an upright position too quickly. They're sitting down for too long or laying down for too long, and we suddenly get them up. It is more common in people who are pregnant or who have received nitrous or IV sedation, so just keep an extra close eye on those groups of people. It usually only lasts for a few seconds where they're just standing up too quick and they're like, whoa, I feel really dizzy for a second. So try to sit the patient up very slowly, especially if you know that that has been an issue for them in the past, and just make sure they're feeling okay before they go to stand up then. Pregnant patients may also feel dizzy or faint after they sit up too quickly. Because of their enlarged uterus, it can sometimes put pressure on their abdominal vein. So if that's the case and your patient is pregnant and feeling sick from sitting up too quickly, try to turn them onto their left side. That'll get some of that weight of the baby off of their abdominal vein, or even move into an upright position to help relieve any pressure on the blood vessels. Next, we'll talk about cardiac emergencies, which can also be called angina. So typically when a cardiac emergency is happening, a patient will report severe chest pain, and that usually is indicating that the patient has some degree of coronary artery disease. The pain usually lasts 3 to 5 minutes, and it can be relieved or erased promptly by administration of a nitroglycerin tablet. Signs and symptoms can include tightness or squeezing sensation in the chest, pain radiating to the left shoulder, or even radiating to the left side of the face, jaw, and teeth. Our response steps in this situation should be to call 911. We'll then position the patient upright, medicate them with a nitroglycerin tablet, spray, or topical cream, which would be located in your medical emergency kit, administer oxygen, monitor and record vital signs. Also, besides just angina, there is a heart attack possibility. Heart attacks are also referred to as acute myocardial infarctions. So that is when the muscles of the heart are damaged because of an insufficient oxygen supply. Prompt medical response can help limit damages to the heart. So if you suspect someone is having a cardiac emergency, we should be responding very quickly to these symptoms. Unexplained chest pain should be treated as a potential heart attack, because if we're just thinking it could be simply angina and we're not taking enough proactive measures and it's actually a heart attack, that can do more damage. So anytime someone's having a lot of chest pain, act like it's a heart attack. Signs and symptoms include chest pain ranging from mild to severe, pain in the left arm, jaw, and teeth, shortness of breath and sweating, nausea and vomiting, pressure or aching, even a burning feeling of indigestion, just a generalized feeling of weakness. So our response steps, again, call 911. If the patient becomes unconscious, you want to start CPR right away. You can medicate them with nitroglycerin if the patient is conscious. If they're unconscious, we don't want to put anything into their mouth. And then we can administer oxygen if they are conscious, and then monitor and record vital signs. These are the steps we take just until EMTs get there, and then they can take over the situation. Next, we'll talk about a stroke, which is also known as a cerebrovascular accident, or a CVA. So a stroke is interruption of blood flow to the brain, and most strokes occur in older individuals who have either predisposing diseases such as arteriosclerosis, heart disease, or uncontrolled high blood pressure. So if your patient has any of these symptoms, just know that they may be the perfect candidate to have a stroke. Signs, though, and symptoms: paralysis. Usually half of their face will be paralyzed to some extent. So if they try to smile, only half of their smile will go up and the other will stay droopy. Even eyes, sometimes the eyes can be droopy on the side that they're having a stroke on. Speech problems as well. Their speech may become a little slurred, hard to understand. They could have vision problems. They may have a possible seizure, and then even difficulty swallowing, headaches, or they may become unconscious. So our response steps: call 911. If the patient becomes unconscious at any point, we want to start CPR right away. We should monitor and record vital signs. Next, we'll talk about hyperventilation. So hyperventilation is usually initiated by stress and anxiety. The patient usually does remain conscious though, which is great, but we need to make sure that we are dealing with this in a positive manner, because if we're freaking out, they're going to freak out even more. So response steps include placing the patient in a comfortable position, use a quiet tone of voice, and just help reassure the patient that everything's okay, and then have the patient breathe into his or her cupped hands. I'm sure you've seen previously at some point in a movie or TV show or something, someone hyperventilating into a paper bag. That can be done, but a lot of times your hands they're available, so just have the patient kind of cup their hands and breathe in and out, and have them just focus on their breathing for a few minutes. Next, we'll talk about asthma attacks. So asthma is a pulmonary disorder characterized by attacks of sudden onset, during which the patient's airway narrows, causing difficulty in breathing, coughing, and a wheezing sound. It can be brought on by allergic reactions, even stress just from being at the dentist, and sometimes respiratory infections as well. Patients with asthma generally carry an inhaler that contains a bronchodilator, which helps relieve the first symptoms of the attack. So generally, patients with asthma, they'll have this, they'll know when they need it, but if it's a child and their parent's not in the waiting room, they may not realize that an asthma attack is coming, and they may need help getting their inhaler. A lot of the emergency and medical kits do have an inhaler with it as well, so if the patient doesn't have an inhaler with them, you can grab one from the med kit. So our response steps: we should call for assistance, not necessarily 911 at this point, but just call for someone else to come in and help you. Position the patient comfortably. Upright is usually best though. Have the patient use their inhaler. If they need oxygen, you can administer oxygen. And then we should also monitor and record their vital signs. Next, we'll talk about allergic reactions. So an allergic reaction is an altered state of reactivity that occurs in body tissues in response to specific antigens. Now, patients should know what they are allergic to unless they just haven't found out that they're allergic to it yet. So always look in the patient's medical history to see what allergies are listed. There are two types of allergic reactions. One is localized, one is anaphylaxis. So first, let's talk about localized. Localized allergic reactions are slow to develop. The patient may have mild symptoms that include itching, redness or arrhythmia, and even hives sometimes. So they'll just kind of be red and itchy. So response steps for a localized reaction: we want to identify the area of the rash, monitor and record vital signs, prepare an antihistamine for administration if necessary. So things like Benadryl can can offset the reaction from the allergen. And then, if needed, be prepared to administer CPR, but usually it's not needed for these localized reactions. And lastly, if the patient is unaware that they are allergic, you can refer the patient for a medical consultation with their primary care physician. Next, though, we have anaphylaxis, which is a more severe type of allergic reaction. So anaphylaxis is the extreme hypersensitive reaction to an antigen that can cause life-threatening issues. So this is very important to act quickly if someone is going into anaphylaxis. Signs and symptoms can include feeling physically ill, nauseous, vomiting, shortness of breath, irregular heartbeat, sudden drop in blood pressure, and even loss of consciousness. So response steps would be to call 911. Anytime they feel like their airway is starting to close, 911 needs called immediately. Place the patient in a supine position, so lay them flat in the operatory chair. Start basic life support if they become unconscious at any point. Get an EpiPen. If they know that they have allergic reactions that are severe, they typically carry an EpiPen, and they may hand it to you or administer it themselves. But if they don't have one on them, there usually is one in the emergency med kit. And then administer oxygen if needed. Always monitor and record their vital signs as well. Next, we'll talk about epileptic seizures. So epilepsy is a neurologic disorder characterized by recurrent episodes of seizures. They're typically controlled with medications, but sometimes even when they have medications, situations where they're in a lot of stress, have a lot of anxiety, such as being at the dentist, can cause a seizure to occur. So there are two types of seizures. First, we'll talk about generalized or grand mal seizures. Symptoms and signs include unconsciousness, increased body temperature, a rapid heart rate, or even increased blood pressure. Response steps. So we want to call 911 when this happens. If the patient is in a dental chair, quickly remove all materials and instruments from the mouth and place patient in a flat supine position to prevent harm. We should protect the patient from self-injury during movements caused by the convulsions of the seizures, and prepare an anticonvulsant such as diazepam from the medical emergency drug kit if necessary. And if the patient becomes unresponsive at any time, you can perform CPR on them. Next, we have partial seizures, also known as petit mal. Signs and symptoms can be just intermittent blinking. Like the patient you may see that they're in a zone and they're not responding to you. They're just kind of staring off at the wall and blinking. That could be a seizure. They could be performing weird mouth movements. They could have a blank stare, just not responsive to their surroundings, and it almost seems like they're in their own world. So response steps would be protect the patient from self-injury, monitor and record vital signs. If the patient is unaware that this is an issue for them, you could refer that patient for a medical consultation with their primary care physician, but sometimes patients are aware that this happens and they just kind of deal with it. Next, we'll talk about diabetes. So there are two types of diabetes. Type 1 is generally referred to as childhood diabetes because it's usually discovered during childhood or early adolescence. Type 1 is an autoimmune disorder where their body does not produce insulin, and the patient then becomes insulin dependent. For type 2 diabetes, it is more of a chronic condition that develops slowly over time. The body is just not using the insulin properly. It usually can be managed, though, with a proper diet and or medication. And in both cases, insulin levels can change due to eating too much or too little, which affects your blood sugars. So first, hyperglycemia means there's too much blood sugar. It can progress to diabetic ketoacidosis and a life-threatening diabetic coma if it's not treated. Signs and symptoms include excessive urination, excessive thirst, dry mouth, dry skin, acetone breath, which almost has a fruity smell, blurred vision, headaches, rapid pulse, lower blood pressure, and even loss of consciousness. Response steps would be, if the patient is still conscious, ask them when they ate last. See if the patient has taken insulin earlier in the day and whether or not they brought their insulin along to the appointment. If the patient does have their insulin with, retrieve it for them, and if they're able to, the patient should self-administer their insulin. Call 911 if necessary. and then if they become unconscious at any point, provide CPR, basic life support. And as always, monitor and record their vital signs as well. Then we have hypoglycemia, where there is too little blood sugar. Signs and symptoms could include mood changes, hunger, perspiration, increased anxiety, or even possible unconsciousness. Response steps would be, if conscious, ask them when they ate last, whether they have taken their insulin, and whether they brought it along to the appointment. Give oral glucose from the emergency kit or a concentrated form of a carbohydrate, such as concentrated orange juice. Some offices have pineapple juice. Usually fruit juices have a lot of sugar that could help raise their blood sugar. But if not, there should be some type of glucose in your emergency medication kit to give to the patient. Call for 911. If they become unconscious at any point, provide CPR, and of course monitor and record vital signs. Next, we'll talk about choking. So choking is the accidental aspiration of a foreign object. Hands may move towards the throat to signal choking, just like in the picture. And if you are coughing or able to talk and breathe, you're not technically choking. It may feel like you're choking, but until the patient can't actually breathe, which means they can't talk, can't make any sounds, they may not be choking yet, if that's not the case. If they are choking in a dental office, it's usually because of something going down their throat during a procedure. So make sure you're using the high volume suction or a dental dam, which would help prevent any choking hazards from occurring. And then last, we'll talk about documenting a medical emergency. So full documentation of a medical emergency is essential. Extensive chart notes in the patient's record should explain exactly what happened. Start with what their symptoms were. Did they tell you that they weren't feeling well? Did something happen that led to a medical emergency? What treatment was provided? And also describe the patient's condition at the time he or she left the office. Because if something happens on the way home and it comes back that you let them go while they were having a medical emergency, the office or the dentist could then be at fault for allowing the patient to be hurt when they should have kept the patient and not let them leave the office. Also, the dentist may call the patient or the patient's family member, even the patient's doctor, later that day or the following day just to see how the patient is doing.